Counseling caregivers at a clinic visit. A 5-step approach. Families want to help their children learn, be happy, and thrive. But parents sometimes need help understanding their young child's needs or need support to be responsive to their children. With observation and tactful guidance, you can help families improve how they raise their young children. This video shows how to assess and guide a caregiver during a responsive care counseling visit. This mother is bringing her 8-month-old daughter to the local clinic. She joins the other parents for the morning health talk. Today, the topic is about how loving care helps children grow and develop. Afterward, the mother waits with the other parents until her name is called to see the counselor. Step 1. Welcome the caregiver. Greet the mother with kindness and respect. Have her sit at the same level without barriers between you. Introduce yourself. Then let her introduce herself and her young daughter. Let her know you're happy to see them.
Great, it's good to have you here.
Explain the purpose of the visit. Tell her you would like to talk with her about her child. Ask if that's okay. Next, involve the caregiver. Ask her how she and her child are doing today. Then, share something about yourself. For example, you tell the mother that you also have a child of the same age as her daughter. Sharing some personal information helps establish a common bond between the caregiver and the counselor. Throughout the visit, use your communication skills to establish a friendly, open rapport with the caregiver. Step 2. Assess. Structure today's session by first reviewing the child's health record. Then ask the caregiver if she has done anything differently as a result of her last counseling visit. Listen closely to the mother to understand her situation.
Whenever she is hungry, then I give her usually porridge in the morning.
Use eye contact and supportive gestures. Give her time to talk.
Yes, and I give her 1 egg every day. Wow.
Then add thoughtful responses and questions.
How's the feeding? Does she eat? Is she taking it?
She is.
The mother tells you she has been introducing more variety in her baby's foods. The child now eats porridge, mashed vegetables and fruits, and 1 egg almost every day.
Kelsey, how lucky you are. That's why she's looking so good. Well done. So,
Ask how the mother typically interacts with her child.
now I want to know, on a normal day, how do you interact with Kelsey?
I'm a busy woman. I'll be doing housework, so I don't have...
The mother tells you that she's very busy. She has so much housework and often carries the child on her back.
She's not sleeping.
No interaction at all.
No, madam.
Do you talk, communicate and play with her? No communication, no play?
Can she talk? She can't talk, she can't understand, so I don't do that.
Throughout the visit, observe how the mother and child interact. You notice that the mother treats her affectionately, but she doesn't have eye contact with her and doesn't talk to her baby. Step 3. Analyze. Pause to think about what you've learned from the mother. You identify that the mother is not talking to the child as much as she could. Then, prioritize what you will do next. Based on what you've observed and learned from the mother, you choose the communication counseling card and consider 1 or 2 small, doable actions that the mother can practice at home. Step 4. Act. You tell the mother you would like to introduce some ideas about communicating with her daughter. Start by praising what the mother is doing well. Let her know that by giving her child a healthy variety of foods, she's improving her child's nutrition. She's doing a great job with her baby. Next, counsel the mother on 1 or 2 small doable actions. First, you recommend talking to her child. You explain that babies begin to understand many words before they can speak, like her name.
Her name, Kelsey. Hi, you see, she 10. Kelsey, good girl.
The mother can talk to her baby all the time. Her baby will learn to talk by listening to her talk.
Kels, baby.
You see? So they are able to make
Second, she can observe her baby's gestures. You explain that babies use facial expressions, sounds, and movements to communicate. Think of an example the mother will know.
If Kelsey is hungry, how would you know she's hungry?
She usually cries. Yes.
usually
So
cries.
in that case, I'll just give her breast milk.
But usually the crying is the last resource she will use.
Explain that while it's true that babies cry when they're hungry, that is a late sign. Before babies cry, they have usually been communicating, but parents may not notice or understand.
She could be rubbing her eyes to tell you that she wants to sleep, or maybe if she's hungry, she puts her hand in her mouth and start sucking it. So, you see, has she done it?
Yes,
You see, and that could be that she's hungry. But if you don't respond to her, she will move from the hand to cry.
Okay.
These are the ways babies communicate before they can speak. Watch your baby and you will learn her language. Then you can respond to her messages and meet her needs sooner before she cries. Parents can also teach a young child gestures to help her communicate. For example, when she's giving her food, she can ask her if she wants more by using a gesture. And if she's full, show her this gesture to say, "All done." Step 5. Summarize and close. Summarize the visit by asking the mother to explain what she will do with her child at home. The mother tells you that she will start to notice her child's gestures and learn what they mean. Then she can respond to her needs better. If she has her hand in her mouth, she will think she is hungry and feed her. She will also talk to her child more often.
Well done.
Encourage the mother. Tell her to try what you discussed each day. With a little practice, this will become natural. Complete the child's health record and schedule the next meeting date. Then thank the caregiver for her time. Remember, follow the 5 steps during a responsive care counseling visit. Step 1. Welcome the caregiver. Step 2. Assess the child's situation. Step 3. Analyze areas for improvement. Step 4. Suggest actions. And Step 5. Summarize the visit.